And we're back, second half of this hour, and our second guest in this hour. We have joining us Dr. Anthony Estreet. He is CEO of the National Association of Social Workers, the NASW. Now, the NASW is the largest membership organization of professional social workers in the world. The NASW works to enhance the professional growth and development of its members, and to create and maintain professional standards for social workers and to advance sound social policies. Dr. Estreet earned a Bachelor of Science in Psychology from Bowie State University, an MSW at Virginia Commonwealth University, a doctorate in social work at Morgan State University, and an MBA at the University of Maryland College Park. He has been a professor and chair of the Master of Social Work program at Morgan State University since 2013. He's also founder and chief executive officer of Next Step Treatment Center in Baltimore, Maryland, and that provides substance use treatment and mental health services. The website for the NASW is socialworkers.org. You can follow them on Blue Sky. Their handle there is at naswsocialworkers.bsky.social. Again, their handle on Blue Sky is at naswsocialworkers.bsky.social. Today, we are discussing Dr. Estreet's recent op-ed in Salon, titled Trump's Executive Orders Are Exacerbating the Country's Mental Health Crisis. More than a pleasure to have Dr. Estreet with us. Hi, Doctor. Good afternoon. Thank you for joining us.
I'm doing, Leslie. Thank you so much for having me.
And thank you for being with us, and thank you for this great piece that you wrote. I hope people will definitely, take a look and read. But for those that can't, or before they get to it, let's talk about this. You talk about the president's executive orders exacerbating the country's mental health crisis. And you start by saying the Trump administration is bent on repealing or ignoring just about every law that gets in the way of its drive to remake the federal government. And you go, but I love this line in this piece. The administration can't repeal the law of unintended consequences. Talk about these unintended consequences that Trump's executive orders are having, and the exacerbation on the country's mental health crisis, Doctor.
Leslie, we're seeing a whole lot in terms of the fallout from the executive orders, from mass firings to people with increased anxiety and depression, really just trying to figure out how to land on their feet from what they had hoped to be a lifelong career in federal civil service. And so we're seeing more and more employees, to include social workers, that are now being impacted as a result. We're seeing the downsizes of a lot of federal agencies that provide a lot of our social safety net. So Medicare, Medicaid, the VA, you name it, we're seeing cuts to all across the federal government. And that in itself creates a opportunity for unintended consequences to see increases in mental health, from anxiety to stress to depression, and really just uncertainty around what the future holds for a lot of our citizens.
And interestingly enough, this is like a catch-22, right? I mean, you have healthcare providers losing jobs, mental health professionals losing jobs, social workers losing jobs that get caught up in, just this massive hatchet job by executive order and otherwise coming out of this administration. But
Mhm.
these are messes that have to be cleaned up by healthcare providers, mental health professionals, social workers who are trying to help others, like you said, are affected mentally and emotionally, anxiety and other things. And these are directives that are created by the President of the United States of America. These are messes that these directives are creating. I would imagine the healthcare providers, the mental health professionals, the social workers aren't going to have the bandwidth, just in numbers, never mind in money, to address all of these messes that are going to have to be cleaned up by these executive orders and by this constant slashing coming out of Doge.
No, absolutely. And we are still reeling from the impact of the pandemic, right? And so we saw during the pandemic that there was a mental health shortage of social workers and individuals providing therapy and being able to respond to this increased need that we had. And with social workers being the largest providers of behavioral health in the United States, we're still trying to catch up to that impact of COVID. Now we're adding on the fear of losing jobs, the fear of being able to provide for family, the fear of what the future holds. That creates a perfect storm for mental health issues, for people that may be considering suicide. I think it creates an environment where we're just not going to have enough service providers to address this need as it continues to increase. And we're not like we're just talking about some of the current policies around cutting federal programs. We haven't even gotten to any of the policies around immigration and any of the policies around diversity, equity, inclusion, and what that might look like to create stressful environments for individuals.
Let's talk about those federal workers and let's talk about some of the numbers. You write in your piece about some experts estimate that nearly 500,000 federal workers could be laid off, and that's within the next 2 years. That's roughly 20% of the federal workforce, which would represent the largest mass firing in American history. And so that people understand there's so many different things. I've heard that Kash Patel wants people to move out of DC to Alabama. Um, you know, I've been fired in my life. There's so much that comes with it, right? One, you have Social Security being threatened to be cut or removed. The market, up until I think yesterday, was just dropping and dropping and dropping. And I'm sure even though there's ups, there'll be downs again. So people are watching their IRAs and their 401ks, if they have those, plummeting. They worry about how am I going to pay for my rent or my mortgage, which continue to rise in most major cities in this country. They worry about how am I going to get another job, especially if somebody is, 45, 50 plus. They
Yeah.
worry about how are they going to pay for their kids' college education. They worry about losing their job. They also lose their health care. The list just goes on and on and on. So talk to us from a mental health standpoint. What does that look like with America? How do you get another job? You're one of 20% just in the federal workforce that have lost your job. There's just not enough jobs to provide for all of these people. And we're just talking about, that sector of the federal workforce.
Hmm.
It's just it's mind-boggling. I mean, I'm getting depressed just saying these numbers.
Well, I think you're absolutely correct in how you laid it out. I think that it creates an unfortunate opportunity for individuals to enter into an unemployment pool that is going to unfortunately be saturated. And then when you're taking into account people's age, location, job skills, that adds to a different level of job searching. I mean, you think about it, some of our federal employees, they entered into this space with the expectation of being in the federal government for their duration of their career, even to retirement. And now, some of these individuals that are, certainly nearing retirement age are now having to rethink about what does it look like to dust off their resume and get back into the workforce, or should they get back in the workforce? But then you have the added uncertainty of the stock market, so 401ks, IRAs, and what does that look like for retirement, or to be able to sustain your current level of lifestyle in today's climate where all the prices for things are rising, right? So we talk about the economy.
Yes.
Everything is much more expensive right now. So what we have thought about retiring with 5 or 10 years ago is certainly different today.
Absolutely. We talk about Washington, D.C., but that's not the only area that would be affected. We have 35 states with at least one county that you write about in your article where close to 5% of civilian employees are federal workers. So this is going beyond the Beltway. And also, some people might say, it's just 4 years, right? It's just 4 years, or it's 3 years and 9 months. But the long term effects of these firings, you write, and I'm glad you mentioned this in your piece, will filter through our society long after the Trump administration is over.
No, absolutely. I think that, some people are like, oh, it's only 4 years, we can make it through. But I think at the same time, like, that is one perspective. But when we think about what these 4 years could look like, it could mean 4 years of somebody not being employed anymore. It could mean 4 years of going from having stable employment to unemployment and relying on social service benefits, which is a scary time, right? Especially when we're seeing potential slashes to Medicaid and Medicare and what that might look like. So we're really seeing an aggressive approach to some of our nation's most reliable social safety nets, right? And so when people get into this space of trying to figure out, what is their next step, it is a very uncertain thing right now within the current administration on what is the impact today, but even what is the impact 5 years from now? Am I going to be in a better or worse position?
Absolutely. Dr. Estreet, we're going to take a break and we're going to come back with you. Dr. Anthony Estreet, CEO of the National Association of Social Workers, the NASW. Check out their website, socialworkers.org. Follow them on Blue Sky. Their handle is at NASW, socialworkers.bsky.social. We'll be back with him. We'll be back with you right after this. And we're back. We are joined by Dr. Anthony Estreet. He is CEO of the National Association of Social Workers, the NASW. Like I mentioned before the break, and if you didn't get a chance, check out the website, NASW Social Worker, socialworkers.org is the website, socialworkers.org. But follow them on Blue Sky. Their handle is at NASW, socialworkers.bsky.social. That's at NASW, socialworkers.bsky.social. Dr. Estreet, we are talking with him about his recent op-ed in Salon titled Trump's Executive Orders Are Exacerbating the Country's Mental Health Crisis. He brings up so many great issues in this piece. It's really great. I hope you will read it. If you don't get a chance, we're talking about it now, but I really hope that you will. Doctor, thank you for joining us, and thank you for holding, and welcome back. You talk about we talked about this being only 4 years, but I want to talk about not necessarily Trump administration, not necessarily what's going on now, but when we look at the history of something like this happening, and you rightly point out investigations that researchers have done with this type of a mass firing. We've seen it in towns where a factory closes, an entire workforce is shown the door. And nearly all of those fired workers, research has found through their investigation, experienced mental health declines. They also found the longer unemployment lasts, the worse they fared. If you have people, especially people, 50, 55 and older, very hard to reinvent oneself and very
Hmm.
hard to find work in the private sector if you've been working for the federal government and as a public sector employee for so long, it would seem that unemployment is going to last longer and longer. And also, when you have so many people competing with you for the same position because they've been shown the door as well. So, can you speak to us about this? Speak to us about some of this research and some of these stats.
I think the thing that I really wanted to highlight is that with all of these mass firings, certainly people will be able to return to the workforce at some point in time, right? But it's equally important to understand that the longer a person is away from the workforce, the the more they're going to see challenges or consequences in their mental health. And so, for example, right, when you go to work, you wake up, you have a routine, right? So when you take somebody out of that routine, they're stuck trying to figure out what to do with their day. And so
Mm.
that normal sense of routine is now changed. And so that can lead to loss of connections with colleagues because certainly you've been around the water cooler and had conversations about, hey, what's going on? How's everything going? And so that stops being able to deal with your routine. So if from 9 o'clock to 10 o'clock you responded to emails, you're no longer doing that. But at the same time, also just understanding that you know, people will also feel this need of lower self-esteem because as you're applying for jobs, if you don't hear back or you get rejections, you start to feel more and more distance away from workforce. And so all of those things have to be taken into consideration when thinking about and addressing uh, mental health. But equally, I think that depending and like you said, depending on age, you have to make a determination if you're going to reinvent yourself.
Right. Or how do you reinvent yourself? You
Or
talk
how do you,
about
or exactly, or how
right,
do you
and
reinvent
and you
yourself?
talk about in your piece, like I love that you talk about if even without serious financial strain. This is what you wrote: if a spouse, for example, is secure employment, losing a job can be highly detrimental to mental health. And then you talk about removing a person's daily routine. Not in your piece, but you can't write everything in the piece. There was something that I had read years ago, um, and I don't want to, at the risk of sounding sexist, but that it's even harder for men because men in our society are looked at, not all the time, but majority wise, as being the provider of the family. And if they no longer can provide for their family, and then they watch that partner, they watch that spouse walk out the door and working, it further emasculates them to some degree.
Yeah, and so I think, gender roles certainly take a front seat when it comes to unemployment, because, like you so rightly pointed out, our society has told us that men are the providers of the family. And so, when a man loses a job, all of those roles come into play, all of those feelings come into play. Am I able to provide for my family? Am I going to be seen as weak or strong? My wife is going to work, or my partner is going to work. What does that look like? How are they going to work, and I'm sitting at home doing nothing? Or right, if they have to start caring for kids or making dinner, like that role reversal takes place. And
Right.
so for some people that could cause even more challenges and end up, with them feeling less than, or again, having lower self-esteem in those spaces as a result.
Right. Also, sometimes socialization. I mean, not just the water cooler. That's an excellent point that you bring up, Doctor. But sometimes people have friendships from work, right? And like Johnny invites you to a barbecue or to play golf or to go to happy hour, on Friday, and that disappears as well. So much to cover. So I want to get to some of
Well,
the
I think to the conversation around the water cooler, the other part of it too is, even if you still have those relationships, there's probably going to be some shame because you got terminated and another person did not. So it creates this natural
yes.
distance because I don't want to come around and feel embarrassed or have people asking me how things are going.
Right. Or the person who has the guilt that everybody got fired but me and, me and Sally kind of thing. I don't want to invite you to my barbecue because I'm embarrassed because I got a job and you don't.
Absolutely.
Right. You talk about our nation experiencing a mental health crisis in your piece for Salon. And maybe people aren't aware of this, but suicide rates are rising. I fear they will continue to when we have so many people who may feel that they have no alternative. They may feel that they can't go on. We have a number of deaths by drug overdose quintupled in the last quarter century. 29 people approximately struggling with alcohol use. Um, I fear these numbers will rise when we see the amount of people that are going to be forced to be out of work and facing, because, people facing financial ruin possibly are definitely reasons that people take their lives, take drugs, drink excessively.
Yeah, and so I think the first thing that I have to do as a social worker is to remind people that if you're feeling down or feeling like you want to take your life or having some struggles around that, please make sure you call 988. There is help out there on the hotline,
Yep.
and there is somebody there that can talk to you to help you address those issues. But to your point, those concerns are going to increase, right? Because as people start to experience anxiety, as people start to experience depression, people that may have been teetering on the line or may have been thinking about it could be pushed over the edge to want to try to, take their life. At the same time, understanding that sometimes people, when things are happening so fast, they may take a temporary situation, such as the loss of employment, as a permanent thing. And we have to help them with correcting their thinking around that. But at the same time, that temporary fear or that temporary spiral could turn into something that changes their life permanently. And so we want to make sure that we are addressing that, making sure that people know how to access help and to get help when they're feeling these things, but also letting people know that, there are mental health therapists and social workers out there that can help them to address this, to cope with this, and come up with some solutions to help improve their mental health and wellness. And keeping in mind that people don't only have to see a therapist or social worker when things are down, they can do it as a way of maintaining maintaining mental health wellness. So all the stress and all the anxiety that people are feeling currently can certainly be a part of seeing a therapist to improve that and to continue down the wellness path.
You talk about, and I know we don't have much time, but you talk about immigration and you talk about the crackdown on undocumented migrants and the permission that authorities have to enter schools, healthcare facilities, houses of worships to arrest people suspected of being undocumented. You talk about the terror and the trauma that sweeps through these migrant communities, but you talk about how this crackdown also has the potential to traumatize U.S. citizens too, and these churches, these schools, these community organizations. You touch upon teachers, you touch upon priests, the list goes on. Can you speak to this? Because I mean, there's so much to unpack here. But if you could just briefly speak to this level of trauma in these situations.
I think, the United States have always had ongoing issues with immigration and how we address it. But currently, this administration has taken a tactic that is allowing uh, immigrations enforcement people to go into schools, healthcare centers, which were normally off limits, right? And so now they're coming into contact with teachers, nurses, healthcare workers that may not necessarily know how to respond because what they may be presented with is a warrant of some sort that they think is official, and it may not be. So I certainly hope that teachers, healthcare workers, and all that are talking to their employers and their legal counsel around how to address these issues because it can be very scary when people are showing up with guns trying to enter your building, and it's hard to say no.
Absolutely. Fear, terrible that it is such a motivator. Doctor, thank you for being with us today. Dr. Estreet's recent op-ed in Salon is titled Trump's Executive Orders Are Exacerbating the Country's Mental Health Crisis. Like I said, his organization, CEO of National Association of Social Workers, the NASW. Check out their website, socialworkers.org. Follow them on Blue Sky. Their handle there is at naswsocialworkers.bsky.social. That's at naswsocialworkers.bsky.social. Dr. Estreet, thank you for being with us. Again, check it out in Salon. Trump's executive orders are exacerbating the country's mental health crisis. It's a great read, a lot of information, things for you to think about, and things for all of us to think about as a society of human beings that should be helping one another. I'm Leslie Marshall, the only true democracy in talk. Thank you for watching. Thank you for listening. And a shout out to Mark Grimaldi, my executive producer. Have a great rest of the day, everyone.